To allegations the government is using bonuses to hide cuts to Medicare Advantage plans in the health care law. Republican Congressman Darrell Issa threatening to issue subpoenas over this. The chairman of the House Oversight and Government Reform Committee joining us right now. What's actually going on here, Congressman?
Well, Neil, what's going on is through a backdoor, an entitlement, $8.3 billion is going to be spent backfilling monies that, according to Obamacare when it was passed, should not be paid. And they're doing it under this loophole, this guise that this is sort of experimental. But what they're really doing is trying on the eve of an election not to have seniors realize that the cuts to Medicare Advantage were real. Now, what's important about this is the money they're taking out of nowhere. This is not appropriated money. This is money that bypasses Congress and just allows Secretary Sebelius, by calling this what she's calling it, to spend $8.3 billion to basically buy an election. And this is what happens when the heavy hand of government has the ability, on one hand, like your last interview, to dictate new fines, and on the other hand, to take money out of the pockets of taxpayers without even Congress's permission.
But if you're right, this means that the price tag for the health care law, as it rolls out, is getting pricier as the day goes by.
Absolutely. Exactly. If they don't have those fines, then they don't score on one side. If they count this $8.3 billion, then Obamacare is $8.3 billion more negative during the first 10 years. And by the way, that's on top of all the new scoring that came out of CBO. You know, Congressional Budget Office missed it. I don't know why, but ultimately, every time they rescore it, Obamacare becomes a bigger and bigger drain. It turns out you cannot insure 32 million more people for free. You just can't do it, and the seniors are beginning to find out right now.
Obviously, I know you want to see Mitt Romney elected president, but to undo this thing, you really need a Republican Senate, right? And without that, is it safe to say the health care law will stand and will grow?
Neil, without a House, a Senate, and a president that want to actually drive down the things that cause health care to cost too much in this country, we're not going to get to affordable health care. You know, we all call it Obamacare, even the Democrats do now, but the fact is it was called the Affordable Health Care Act, and it did nothing to make health care affordable. It did do a lot of spending of other people's money on health care, but that doesn't actually drive down the cost. To drive down the cost of health care, we have to deliver it intelligently. We have to do some things that were in Obamacare, but quite frankly, we've got to deal with the things that drive up the cost. Your last caller dealt with it, trying to find people if they have to come back to a hospital while incentivizing the hospitals to send them out too soon. Both of those send the wrong message. It's not doctors and healthcare professionals making fair evaluations. It's government's heavy hand.
Mr. Chairman, thank you very much. Good seeing you again. Darrell Issa in Washington.
Thank you, Neil.